Really, really excited. We're about to dive into what should be a really fascinating conversation over the next 45 minutes that focuses on medical innovations, what's happening in our healthcare system right now. Of all the different areas that we have had the pleasure of diving into through this Breakfast with Halcyon series, whether it's, looking at what's happening in criminal justice right now, diving a little bit further into the food and restaurant industry, there's been no topic perhaps that has been more impacted and is really the front lines of our current crisis with COVID-19 than the medical field, our healthcare system. And so we're going to be able today to talk with three Halcyon Incubator Fellows who we've had the pleasure of working with at Halcyon to dive a little bit deeper in there. So before we get started, just a little bit of background. First, for those I haven't met yet, hi, my name is Ryan Ross. I'm the Chief Innovation Officer at Halcyon. Really thrilled to have you joining us. So this series, if this is your first one, is intended to get your Wednesdays off to a great start. Everyone's working from home and so many people are remote right now. So we really wanted to provide a little bit of information, insight with some of the people who are at the front lines of different industries across our economy. And again, we can think of no better conversation to host this morning than with our three panelists today. Very quickly, for those of you who aren't familiar with Halcyon, we're a nonprofit based in Washington, D.C., and we supercharge social entrepreneurs with world-changing ideas. And the biggest way that we do that is actually through fellowships. So we have a very competitive process, but ultimately arrive at fellowships both for social entrepreneurs and artists. And so the individuals you've seen today are folks we've had the pleasure of working with over the past few years now. We're gonna dive in. I've got a ton of questions. I really am excited to have you all meet the incredible women who are on the call today, who are gonna be joining this panel. But I will flag that we'll also have an opportunity for you all to ask questions. I will not monopolize the question asking today because I know that everyone has a lot of questions, especially as it relates to our healthcare system right now. And so we're going to use the chat feature to be able to you can either send your message in there or if you want to actually ask your question yourself, if you go to the participants tab, you can raise your hand. I'll call on individuals and you'll have a chance to ask your question to the panel. So we'll go ahead and dive right in. Again, for those of you just joining, welcome to our Breakfast with Halcyon series. We're going to be talking today with three incredible individuals. I'll start first. Catherine Clayton, who is in our 10th cohort, the founder of OmniViz, is someone who is definitely in the top 1/0.5% of the smartest fellows we've ever had at Halcyon. You'll understand why very soon. Really excited to have you joining us. Would love to maybe hear a little bit about kind of your background and a little bit about what OmniViz does.
Yeah, sure. Thank you. So I'm based here in San Francisco, so I'm sorry about the dark background, still waking up. And yeah, so OmniViz it's a diagnostics and detection-based company. I've been pretty obsessed with healthcare since I was a little girl because we were going through a very different pandemic at the time, and that was the HIV pandemic. And my uncle had died from full-blown AIDS when I was a little girl, and so I became very interested in health from a young age. And went and did biomedical engineering and started this company. And what our company does is we make handheld devices to rapidly detect the cholera pathogen in water in under 30 minutes. And cholera, it's in 41 countries around the world. It affects 5 million people every single year. And it's taking about a week in the current state to detect cholera in water. So people are vulnerable to what they're drinking, cooking with, bathing in, and so that's why we decided to do something more rapid and do this in 30 minutes. And we made the device so that anybody with even a middle school education can use it. You don't need a scientific background in order to operate the device. And we're able to show the data to show where these outbreaks are happening. And so that way you can send resources to the area that's in most need. We started there, but we've also been working on a lot of other diseases lately, such as malaria. We're about to publish a paper on malaria and blood testing in our device as well, and HIV testing. So
it's incredible work. And I think, for across the board, I think we have a renewed hopefully appreciation for the importance of accurate testing. And we're going to dive into a lot of this conversation. But first, I want to bring in the other two panelists. Yoko, I see you right below Catherine on my screen, so I'll go to you next. Yoko is actually in our fourth cohort, and of maybe all the fellows we've ever worked with at Halcyon, perfectly kind of represents the blend between the entrepreneurship and the art side of things. So I'd love for you to maybe give a little bit of background on yourself and a little bit of your work with SenSound.
Thank you, Ryan. Good morning, everyone. I hope you are doing okay. It's a challenging time. I have my good days, bad days. This is definitely a good day to see everyone. So my name is Yoko. I am a musician by training. And the venture I do, SenSound, is we have a vision to transform the sound environment in hospitals. I spent quite some time in hospitals as a patient, and I was very disturbed by the noise in hospital environment. So after I got better, I wanted to do something to improve that sound, and unexpectedly it was supposed to be fixing sound, but the whole process has become a little more than that. So currently we work with different hospital partners, primarily with leadership of different hospitals, as well as medical device companies to help change the sound that we hear in hospitals today.
Incredible work, and thank you for joining us this morning. Last but certainly not least, I want to bring in Dr. Yolanda Hancock, who was in our 9th cohort, is both a pediatrician on the front lines of this crisis, and at the same time also has time in of the many hats that she wears, has an incredible startup in the work she's doing. So so Yolanda, maybe you could talk a little bit both just about your background, but then also a little bit about your work with Emphasize.Me.
Sure. So I have the privilege of being a pediatrician in the midst of a pandemic. I'm also a public health professional. I'm a professor at Milken Institute School of Public Health at George Washington University. And in my county, I serve as the consultant for the Prince George's County's County Council when they sit as the Board of Health. So you can imagine I've been insanely busy. It just so happens that I made a pivot. When I was at Halcyon, I was working on technology called Emphasize.Me, groundbreaking technology to help teens achieve their weight loss goals and help doctors really be able to visually demonstrate the diagnosis of obesity. But because of funding issues, I needed to make a pivot and decided, based on feedback that I had received from Halcyon, from my cohort members, and from a couple of advisors, why not create a telemedicine platform in order to, one, increase my reach, two, show that adolescents and other individuals would use an online platform to achieve their weight loss goals, specifically within the African American community, because not a lot of data has been used to demonstrate how well people of color are using online platforms as it relates to health, specifically in the clinical space. And so I decided to develop Ask Dr. Yola. So outside of Halcyon, I'm known as Dr. Yola, and particularly out in media and those sorts of things. And so we figured it makes sense because people ask me a lot of questions, particularly now, and launched officially on April 15th. Again, the timing just worked out perfectly because I had already talked or planned to launch a telemedicine platform in anticipation of a TED Talk that I was supposed to be doing next week or last week. It was supposed to all happen all together, but fortuitously, but unfortunately, it was needed now. So I don't have to, I still do house calls, but I don't have to do as many house calls because I now have launched the telemedicine platform. And thank you guys for having me.
Well, you know, I mean, timing is everything, as they say, and you know, fortunately, we have each of the three of you at the forefront of how we're thinking about innovation and integration of technology to really think about how we get better outcomes across our healthcare system. Each of you has a very unique perspective that you bring to this. So, Yolanda, I'll start with you, given that you just solicited yourself for people asking questions. So I'm going to ask Dr. Yola as well. You know, you are, again, very much on the front lines of this, and so there would be no more of an appropriate place to start than with the current crisis that we're facing right now. What are you seeing on the front lines? What is your day-to-day like as you're trying to help patients navigate a global pandemic?
Sure. I think from a pediatrician standpoint, I have to be grateful that COVID-19 isn't impacting children in the way that our standard influenza or even H1N1 was. I actually diagnosed the first pediatric patient in the DMV with H1N1 back in 2009. So I've gone through epidemics before. This is my first pandemic. I have actually been seeing adults. One of the public health hat that I wear really compels me to make sure that testing is not a barrier, and I'm sure we'll hear a lot about testing soon, but it's very, very frustrating. One, when there are people at risk, particularly our frontline workers who can't get tested because we're still following the CDC's very strict and what I consider to be ridiculous guidelines, given the fact that the pandemic is now endemic, which means it's within the community via community spread. For me, it's not scary because it's what I do, but for my community, it's very scary, particularly when we hear about the health disparities demonstrated by COVID-19. I live in Prince George's County. Prince George's County leads the entire state of Maryland in terms of deaths and infections. It leads the DMV. To be honest with you, it paces Virginia as well. And so, that's a challenge, not having enough PPE. I actually am going on a PPE run today to drop masks off to Howard University, United Medical Center, and to our prison here in Prince George's County. We dropped off masks yesterday as well. Because that's part of what I feel I need to do. I'm on the front lines, but sort of in the periphery. Most of my patients I see at home and they're not as critically ill as some of my colleagues are seeing in the emergency department and in the hospital.
Yeah, I mean, it's just a crisis that touches so many aspects of our society, and I think that's one of the most unique factors, just kind of the ubiquity of this. And you brought up testing. I actually want to bring in Catherine now as well on the testing side, because I think that obviously this is one of the many areas I think of the response, especially in the United States, that has perplexed some people, that we just haven't been able to have the same level of testing that we've seen in a lot of other countries, especially in a country where we often think about ourselves as leaders in a lot of aspects of healthcare innovation, right? But clearly there are disparities between the innovation and the outcomes. Can you walk us through kind of why we are where we are? What is the current state of testing? And I'm often confused by it because it seems that some tests take weeks to do. The CDC has tests, states have tests. Maryland just bought hundreds of thousands of tests from South Korea. I don't really get it. So maybe you can demystify some of this for us.
Yeah, I mean, it's a massive ecosystem. Sometimes it still bamboozles me, and I feel like I'm pretty obsessed with this. So it's crazy, and I would love to hear it from other people's opinions as well. But yeah, starting from the beginning, there were a huge flood of samples coming in, and there just weren't enough tests to be able to keep up with the amount that was coming in. And so I think I looked at the numbers recently, and they've tested about 1 million people in the United States, but their entire goal is to get, I want to say like something like 30 million, and it's going to take billions of dollars to get there. And we look at the states that are leading in testing, which is New York by number and per capita, as well as Louisiana, because they're really going up and skyrocketing in numbers as well. And then we see states that are lagging, one being my home state of California, and Oklahoma and Texas. Texas is a huge state, and that's kind of, I don't know, it's kind of alarming, really. And so without this testing, we're not able to get a good handle on the problem. Diagnosis is one of the biggest ways to be proactive rather than reactive. But a lot of times too, there's a lot of conditions on being tested. So just yesterday, LabCorp put out the very first at-home COVID test, which is very cool. But part of that is you have to fill out a survey that goes to your doctor to be able to be approved to get that test at home. If you're asymptomatic, I could see how that could be an issue. So you're not exhibiting any symptoms. I mean, it's hard to be able to want to administer that test. But I do like that there's this concept for this at-home test. I like that they're first focusing on the front lines, those that are doctors, those that are nurses, the ones that are actually, there. And then after that, in the next few weeks, they're going to be administering this to more of the public. As well as so looking at the types of tests, there's two types of tests. There are the molecular kind of tests, which means looking at the nucleic acids, the RNA, what makes up the virus. And then the other side is antibody tests. So nucleic acid tests, there have been a few that have been pushed through the FDA, one being Abbott. If you've opened the news ever and seen somebody get glorified for a diagnostic right now, it's Abbott. They got emergency use authorization from our FDA approval. And their whole thing is that if you have coronavirus or COVID-19, they think that they can do it in 5 minutes, which is amazing, pretty fast. But that also comes at how much virus or what's your viral load in your body. The other big one is Cepheid. They've come out with a test on their Gene Expert, and their Gene Expert's been out on the market forever for other types of testing. So those are kind of the big ones. Then we have the antibody tests. The antibody tests, there's not any that have been FDA approved yet, but there have been some that have accidentally claimed that they're good for use, not knowing really that whole FDA emergency use authorization is pretty important to get. And the thing with the antibody tests is right now the World Health Organization is saying that only about 2 to 3% of people who are being tested are exhibiting antibodies in their system, which is a problem. That means a lot of people don't have these antibodies. So how accurate really is this test? So that's been a big thing that's of people suffering with the sensitivity, the specificity, the accuracy of these tests, which is incredibly important in all diagnostics. It's what we measure ourselves against. It's like the gold standard. So how do you overcome that? And so there have been a lot of debates. And so what a lot of antibody tests or a lot of antibody test companies are doing is they're saying, we'll just use this for surveillance. How good or bad is that? I would love to hear from the others what they think. I'm not particularly a fan yet, so I can't wait to see improvements. And then you talked about other countries. I just love the South Korea example because when we first started hearing about this and it went from China to South Korea and it was all over the news, I was watching super heavily because I was just enamored by the fact that they had drive-through testing throughout the country. I thought that that was incredible. I was like, wait, you get to just drive through and get tested and you don't even leave your car? Like, amazing. That is how we should be looking at this kind of testing. That's how we should be making things more accessible to people. How can we do that? And they've flattened the curve. So this morning I was curious at what their numbers were, and they're down to 22 cases.
Wow.
Incredible. I wish we could say the same here.
Yeah, well, we'll keep our fingers crossed. Maybe, I know the government's done a lot to, kind of have companies like GE and stuff to, kind of work, on behalf of this crisis. Perhaps next is the McDonald's, the Burger King, so we can get all the drive-through capabilities that they've been perfecting over the years to be used for testing. But let me actually jump back, Yolandra. Obviously, Catherine provides a perspective on kind of where the testing is kind of at a macro level. I want to then also zoom into kind of what you're hearing from doctors you work with. What are you seeing yourself in terms of the availability of testing for your patients? Obviously, it's changing in real time, but what's the state of play right now?
So currently, I live in the state of Maryland, so my testing capability is about to increase exponentially. That's been our biggest, one of our biggest frustrations. Our current frustration is people opening up their states too early. That's just a complete slap in our faces. But in terms of testing, one of my most frustrating areas in the practice of medicine are empty promises and the slowness of response. There was already testing. Catherine said it perfectly. South Korea created a testing model. They compelled biotech companies to work collectively together to create testing modalities so that they would be able to have a quick response. And clearly that was not the case here in the United States. Not only was there not the use of currently existing technology, but there was a slowness to respond with the creation of technology for testing here in the country. So much so that the assay, what is needed to actually get an accurate result, was wrong. It was contaminated with COVID. And so for 2 weeks, we were again delayed because the current test that came pushed out through the feds was not an accurate test. It was contaminated, so people were testing positive when they weren't. We also know that, as Catherine alluded to, the specificity, no one is having a conversation about false negatives. So I've had 2 patients who tested negatively, but clearly from a clinical standpoint had COVID-19. Flu was negative, everything was negative, but they had the symptoms. And luckily they could afford, because they had paid sick leave, to be able to stay at home. My hope is that we expand testing across the country when each state is allowed to do what it wants. We're not ever going to contain COVID-19 because some states are not going to feel compelled to invest in testing. And the virus does not respect state borders. So I mean, that's my honest answer, is that it's still very frustrating. Even if Maryland gets 500,000 tests, but other states do not do the same, we're going to continue to see the same cycle.
Yeah. Yoko, I want to bring you in here. You know, I know that you you work with a lot of leaders in hospitals across the country, frankly, across the world. What are you hearing from them right now? I mean, we know that, you know, hospitals are in many cases like really ground zero for where this crisis is hitting hardest. What are you hearing from them? You know, I want to, you know, kind of piggyback on that, and also, you know, a lot of your work deals with, you know, what the quality of a hospital setting is like. Is that contributing to a patient's health or not? And obviously to the healthcare practitioner's health as well. We're in a crisis situation right now, but obviously that's as important as ever. What are you seeing on the ground?
Yeah, it's incredibly difficult right now. One of our hospital partners is a system in New York, and it's incredibly difficult. But I'm also hearing this theme almost across different people, which is that during this difficult time, people are coming together to try to do things that were rather difficult under normal circumstances. So I'll share some examples. One hospital system in Eastern North Carolina, we worked with their chief experience officer. They primarily, you know, serve marginalized poor communities. But you know, a few years ago, one of the things we did with Johns Hopkins was to create this relaxation space for healthcare workers, hospital team members, because there's no space in hospital facilities typically for nurses and doctors and people who work in hospitals to take a moment to relax. So this healthcare system in North Carolina, during this crisis, they basically created 5-6 staff tranquility room within their facilities. They reached out and they said, we are just watching your video and reading your paper, and we try to do what we can, and we created those space for clinicians. You know, idea like that, which seems so simple, is so difficult to happen during the normal time. But you know, in this kind of a circumstance, other example, my friend, colleague is very quickly put together this collective of healthcare designers from leading academic, you know, healthcare institutions. And he said, typically, you know, those are the people who don't talk to each other, but during this time, people tend to just put their ego or, you know, whatever aside, and they're just like, what can we do together to help? Medical device companies that we work with, I was pleasantly surprised and encouraged by how much they are, you know, like we have to be working on effort that would help the healthcare workers who are, you know, suffering right now, but we will have life after this pandemic. We will have crisis. We will have a, you know, life after the crisis, and we have to be preparing for the world after the crisis as well. One device company, you know, we are collaborating to collect the stories of healthcare workers on the front line and create, you know, audio piece together. People are willing to do something different. You know, legal people are more open to pass things quicker. So all those things are extremely difficult. I like to point out that the people are trying really hard right now.
Yeah, and you bring up a really great point. I want to kind of take one last question selfishly that's on my mind, but then right after this, we're going to be opening it up to everyone who's on the call. So I do want to flag that very soon we're going to open it up to Q&A. So begin thinking about the perfect wording for that brilliant question you've been ruminating on. But you know, I think each of you, so kind of looking towards that future, I think it's a great segue. You know, we're going to come out of this, and I think that, you know, there's going to be a lot of damage. Clearly, there's also going to be a lot of ways that our healthcare system grows and develops and evolves. And I think one thing that is, you know, almost a certainty is that we're going to be moving to a place where the use of technology, especially as we're thinking about what the healthcare system is looking like moving forward, is going to be fundamentally different than how it looks before. Each of you, in different ways, is integrating that technology. And so I'd love, from your vantage point, from the vantage point of as a startup founder, as an entrepreneur with a technology that you're hoping will transform a part of our healthcare system, what is your hope for the lessons that we learn and how that kind of changes kind of the state of play for your work and what you're doing? So Catherine, maybe I'll start with you first there.
Yeah, sure. So a lot of hope. The big one that I have is that when we're changing, being able to implement more of these telemedicine solutions, more of these mHealth solutions, because now we see that when faced with having to shelter in place, to be at home, that suddenly it is accessible to be able to create these solutions to seek healthcare. The other one I would say that I have a lot of hope for is collaboration, really kind of joining together. So for example, we do diagnostics and we do detection, but when this began to happen, somebody on my team has a lot of nurses in his family, and they said, we are wearing a mask a week at our healthcare facility. And, you know, we're engineers, my team's engineers. So suddenly they're FaceTiming me and they say, hey, can we come up with a mask that fits all types of faces and that they just, you know, replace a hospital grade filter? And I said, sure, let's 3D print it. Let's open source it so that people anywhere can help print these and distribute these. And that was kind of a new sense of collaboration, was working with these nurses, working with our team, and something that we hadn't particularly done before. But I think it's just an example of how universities are starting to work together, research groups are starting to work together. It's been a lot of collaboration. So I hope that keeps going in the future, because I think that that's how true innovation moves forward.
That's incredible, and hopefully there is a renewed and sustained interest on the testing front in general, because, you know, while obviously this is one of the most acute pain points we've been facing, you know, we have persistent diseases that affect us across the globe. So anyway, just again, thank you for the work that you're doing. It's just incredibly important. Yolandra, maybe I'll jump to you next.
Sure. I think my first hope is that we continue to innovate in the clinical space. You know, people think about physicians, but we also have to think about individuals like dentists. How do they protect themselves and their patients, and how do we use technology innovation in order to do that? The second is compensation. I mean, we are all entrepreneurs, and prior to COVID-19, third-party payers, insurance companies were only paying physicians $15 to $20 for each telemedicine encounter, where we're providing the same level of expertise, the same amount of time. It's simply not a face-to-face visit. As a result of policy change, CMS, the Center for Medicare, has offered us full compensation in the same way they would for a person-to-person visit, but not all third-party payers are following that policy change. So my hope is that they will fund the technology we develop. And then the third is that now that people appreciate what health disparities are, that there is an investment in public health, not just in terms of pandemic response, but in terms of just basic human care, dealing with food insecurity, home insecurity, like all of those areas of focus that facilitate the disparities that we're now seeing as a result of COVID-19, but that people like myself have been aware of since literally my birth. So those are my hopes.
It's incredible, very hopeful, and again, really appreciate of all the hats you're wearing, just the incredible work you're doing every day. I mean, we wouldn't be where we are without people like you. So thank you. Yoko, I'll turn to you last here. Tell me about, what does the future look like?
So, in particular to things that we are doing, one of the things we have been doing is to collaborate with medical device companies to focus on those beeps that we hear in hospitals, some of those sounds that haven't changed for last 40 years. Like no one ever thought of changing that. And just right before the pandemic, our plan was to kind of do a participatory design so that people who have to hear those sounds every single day get to participate in the process of redesigning those sounds. And with this situation, initially we were like, oh, now we can't, we have to wait, maybe we have to, people are now is not a time to go to hospitals and do a participatory design. And I'm changing my mind as we are, continuing to work with those partners, that now is actually the time that to really fundamentally rethink the way that how those hospitals are being designed, and this pandemic brings about things that were not functioning before, but we didn't really focus. So take this as an opportunity, and some of us respond during the crisis, but some of us will have to stand up when this crisis starts to come down, but people will be fatigued, right? And then those of us who get to stay home and work from home, there will be our time to support the people who are working really, really hard right now. So I don't know if that answered your technology question so much, but yeah.
No, I mean, again, it's very hopeful. Like, what are the ways that we're going to be able to sustain this focus on ways we can continue improving our healthcare system? I think it's incredibly important. So we're going to jump to audience questions in just a second. So if you have a question, you can actually go ahead and raise your hand right now. You don't have to physically raise it. Don't worry, it's too early in the morning. You might not have had your coffee yet. This might be a lot of work. So all you have to do is you go to the participants bar at the bottom, click on it, and there should be a raise hand function, and you'll have your little blue hand that comes up, and we'll give you a call. But first, I'm going to jump to my colleague Andrew Jacobs from Halcyon. Andrew, how are you this morning?
Hi Ryan, good. How are you?
I'm doing great. I would love to hear a little bit. I know you've got a quick message for the audience today.
I do. Thank you everyone for being here. We are so grateful that we're able to continue to bring our community together in this way. We would not be able to be Halcyon with events like this to support our fellows and to give voice to some very, very important issues. We also couldn't be here without the financial support of our community, because we are a 501c3 nonprofit organization, and that means that we rely entirely on donations from individuals and corporations and foundations. And we are not stopping right now. We're doubling down to support our fellows in this time because independent artists and social entrepreneurs and small businesses need support right now. So we're creating events like this. We're continuing to extend our housing. We're being very attentive to all of their needs right now and making sure that they are supported in the best way possible. So if you believe that independent artists and small businesses are our future, once this crisis ends and we're trying to recover, we do highly ask if you could pass the hat in some way, if and only if you're in the place to do so, at halcyonhouse.org/donate. A small donation today will be able to help continue our programming. If you would have taken an Uber to join us for an event like this in person, consider sending that $6 that you would have sent to Uber to Halcyon, halcyonhouse.org/donate. I can post that in the chat for you all, but please, Q&A, let it happen.
$6 for an Uber. So I guess you were taking a pool to Halcyon. Okay.
Yes.
Yeah, probably from somewhere not too far away. Okay. All besides the point. So again, please go down into the managed participants section, raise your hand, and we'll call on you. Actually, our first question comes from the chat. Nicole asks that a friend told me the other day that FDA processes right now are sped up and relaxed. So the question is, do you worry about the backlash coming from relaxed regulations and standards? So Yolanda, maybe I'll start with you on this one.
Absolutely. I think that's a fantastic question. I always say you don't throw the baby out with the bathwater, but for testing and for treatment, right? There's a lot of conversation about using chloroquine. There's a recent study that just came out that demonstrated that chloroquine made no difference in terms of clinical outcomes. But because we're in such a rush, and I get it, we're in the middle of a pandemic, we want to fix and we want it quickly. But there are specific reasons why these measures are in place, and it's to protect us as consumers. When we see medications being pulled off the market, Zantac, while we're in the midst of this pandemic, was pulled off the market because of contamination and the risk of cancer. We can't just go to something that we think works because the president said so. There are steps that have to be taken that show efficacy of the treatment, specificity and sensitivity of the testing, so that we don't give people false hope. And although I think we should definitely expedite certain processes that end up really being about money and not about safety or efficacy, we have to be cautious. And also in terms of the vaccine, in order for consumers to trust the vaccine that's going to be ready within who knows how much time, if the sense is that it's been expedited, people aren't going to take it. I feel like a used car salesman when it comes to just trying to get people to take a flu shot. The likelihood of them being open to a COVID-19 vaccine that seems to have skipped some steps, it's not going to happen. I'm already seeing conversations amongst my patients, particularly amongst the African-American community, that already has a distrust of the medical system. If steps are perceived to be rushed, COVID-19 vaccination is not going to be accepted.
Yeah, that's a fascinating perspective. Catherine, I think you might have a few quick thoughts on the backlash question.
Well, first of all, I heard safety and efficacy, FDA, that's like slammed into your head, right? But I totally agree, is that what, like, especially for the drug perspective or the therapy perspective, it takes oftentimes 10 years to get a drug through the FDA, and suddenly we're rushing it. Now, granted, I don't think we have 10 years to go through things, but if we're suddenly going from 10 years to such a short timeline, shouldn't we be questioning how well that's being evaluated, how well that we're going through that entire process? Second thing is, yeah, distrust in the medical system. Absolutely. There are, just depending on like socioeconomic status, that changes so much with your trust with the medical system. And then suddenly you're telling me that you're rushing through this process to get it through. How does that help my sense of trust? How does that help my ability to feel like I'm safe? And then also on the diagnostic side, it also takes a few years to get through. It's a much shorter process, especially if you have what's called a predicate device to kind of go off of. But once again, except for I do see Abbott kind of translating their current system, or Cepheid with their gene expert translating their current system, but it is going through rather fast. So I would be curious to get on the inside and kind of understand a little bit more about that process for sure.
Awesome. I'll go ahead. I've got many more questions. One of them in particular, and this can be for any of the panelists. You know, obviously we've seen a lot of examples of how people are responding to this. In particular, our leaders, whether they're you know, political leaders, you know, civic leaders in some way, hospital leaders in the healthcare system. What's been an example of leadership that you've seen, and what's been a lesson that you've taken away from, in a positive way, from how someone has responded in this crisis?
I'm going to punt it to Yoko.
I'm trying to think, the primary example being the one I raised earlier, the chief experience officer creating those spaces for caregivers.
So I'll take it back, Yoko, and give you some time. I think for me, the community, right? When when it was said that we were running out of PPE and healthcare providers were dying, and they continue to do so, the community reminded me of Rosie the Riveter. Everyone passed around the Vogue face mask pattern and started kicking out fabric masks like you wouldn't believe. Organizations came together, all kinds of different nonprofits came together to really stand up, not just for healthcare workers, but for everyone on the front lines. And I've never, like in my 40-something years of life, I've never seen the community come together in such an amazing way. And it really shows that we are our own rescue. Like when the powers that be cannot provide us with what we need, the American people did.
That's incredible. Another question coming in from Eugene Kim, and so I'll kind of reword this. I know, Eugene, you said that we kind of touched on this a little bit, but maybe I'll expand the previous question in a way, which is just what are the stories that they can share with their friends and colleagues to counter kind of the doom and gloom stories that seem to dominate many pre-Zoom meeting conversations these days? What are the things that are giving you hope and inspiration?
So, I don't know if this would answer the question, but one thing I think it's important to address is that I guess in American culture, there is this whole like a superhero narrative, right? Like healthcare workers are heroes, and they are absolutely heroes. But I also hear from my friends and colleagues that the use of the word hero can be dehumanizing sometimes because, it separates them from the rest of us. And in this situation, there is no separation. Like they can also be the people who are being treated, and by calling them heroes all the time, there is a pressure that we are unknowingly putting on them from the perspective of PTSD and trauma therapy. That I think it's a very unique situation, that it's almost like anticipatory trauma for many people, that oftentimes disaster hits and you respond, but in many communities it's the fear of unknown right now, like how bad is it gonna be, like how soon, and am I going to be able to give enough? So and I think it's tempting to find inspirational stories, of course, but I think it's also inspirational for us to know that there are people, there are ordinary humans who are doing this extraordinary work. And so I like us to continue to think about how can we as a community support them, and not just healthcare workers, like workers on the front line doing difficult work in every sector. So yeah.
Well, that's a really beautiful note to perhaps lead this conversation on. We're at 9 o'clock now, so hopefully this has kicked your day off in a very positive way. Hopefully you've learned something. I know I certainly have. So we're going to be doing this Breakfast with Halcyon series again. We'll be doing it next week. Our topic is also very timely. It's on immigration and refugees. I don't know if you noticed, but we're not accepting immigrants into the country for 2 months. What does that mean? What does that mean for the system? Where are we going? What is that experience like? We're going to again be talking to some Halcyon fellows who are at the front lines of the system. So please join us. That'll be same time, same place, 8:15 a.m. Right here on Zoom. And also I want to flag that on Friday, we're having a community-wide our citywide Arts Community Day event. So that's going to be on Zoom. Again, it has to be virtual now, but it's going to feature fellows and community partners across the DMV region who showcase the resilience and creativity that these practitioners are bringing into their work every day. So all of that will be sent to you in a follow-up email. So you don't even need to search for a link. We'll send it right to you. But it should be some incredible programming. So hopefully this gives you a little bit of light, joy, inspiration in your day-to-day. So thank you again for joining us. We hope you have a wonderful Wednesday, a wonderful rest of the week.